Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, my name is Ryan Severson. I'm a partner in the firm's Chicago office, where my practice focuses on healthcare regulatory matters, including pharmacy compliance and operations, as well as advice on digital health and other issues. In this episode of Triage, I will cover the Federal Health IT Strategic Plan released in January by the ONC, which is the Office of the National Coordinator for Health IT within the U.S. Department of Health and Human Services. The strategic plan not only gives a glimpse into where federal agencies may be headed on health IT issues, it also provides a valuable opportunity to engage with the government as it puts the plan into action. For example, public comments on the draft are due by March 18th, and we encourage those who may be impacted to consider how best to engage with the government, not only with comments in the short term, but looking ahead as well. But first, a bit of background. The draft report follows on the 2015 to 2020 strategic plan, also published by ONC, which collected input from a slew of federal agencies to provide broad direction on federal health IT policy. The agencies involved in contributing to this latest report include HHS, Department of Defense, Department of Justice, the Federal Trade Commission, the Department of Homeland Security, NASA, the Department of Commerce, and others. In putting the report together, ONC notes that federal agencies are purchasers, regulators, developers, and users of health IT, so there is significant public interest in making sure health IT policy is directed in a thoughtful way consistent with principles shared across the healthcare industry. ONC envisions that the final 2020 to 2025 strategic plan will serve as a roadmap for agencies and drive private sector alignment on health IT issues. Officials plan to use it to prioritize resources, align and coordinate across agencies, and benchmark progress over time. In terms of structure, the plan includes 4 specific goals with objectives and strategies to achieve them. However, at the outset, ONC notes that these items should not be viewed as sequential, but rather as interdependent with the collective purpose of improving health. The first goal identified by ONC is to promote health and wellness. Under this goal, ONC discusses improving individual access to health information by enabling individuals to access and interact with their health information securely, promoting the portability of health information through APIs, using IT that allows individuals to send and receive their health data across multiple platforms, and improving access to technology broadly. Objective 1B in promoting health and wellness, according to ONC, is to advance healthy and safe practices through health IT. Here they talk about promoting healthy behaviors, leveraging individual and community-level data to aid in public health, and advancing the use of evidence-based digital therapeutics for patients to manage conditions through their electronic devices. In this regard, ONC also says that integrating health and human services information is an objective. For example, strengthening community health IT infrastructure, educating on how to use health IT to address unmet health and social needs, and integrating social determinants of health data into EHRs. Goal number 2 identified in the strategic plan is to enhance the delivery and experience of care. Here, ONC writes that agencies should work to ensure safe and high-quality care through the use of health IT, such as optimizing delivery through machine learning and evidence-based clinical decision support, improving patient matching, and customizing care through precision medicine. Another goal is fostering competition, transparency, and affordability in healthcare. For example, by encouraging pro-competitive business practices, making information more available to individuals, and educating consumers about how to use their health information to shop for care. ONC also wants to reduce regulatory and administrative burdens on providers. Here they discuss strategies like simplifying and streamlining documentation requirements, monitoring the impact of health IT on provider workflows, and harmonizing data collection and reporting across different agencies. And finally, ONC discusses the importance of a workforce that confidently uses health IT. Here they mention continuing to invest resources in the federal health IT workforce, as well as increasing education and training on health IT broadly. Goal number 3 in the strategic plan is to build a secure, data-driven ecosystem to accelerate research and innovation. Here, ONC discusses 2 sub-objectives. 1 is to advance individual and population-level transfer of health data, for example, by improving data governance standards. And 2, to support research and analysis using data at the individual and population levels. Strategies here may include increasing research into targeted therapies and making greater use of machine learning and predictive modeling across different government programs and the private sector. Finally, the strategic plan's 4th goal is to connect healthcare and health data through an interoperable health IT infrastructure. Here, ONC discusses a variety of strategies, including establishing transparent expectations for data sharing, for example, by curbing the practice of information blocking, as well as supporting a common agreement for nationwide exchange of health information, Another objective under Goal 4 is to enhance technology and communications infrastructure. And this is particularly important when discussing gaps in broadband and wireless access across the country and adopting the infrastructure that's needed to support telehealth, particularly in rural areas. Finally, federal health IT policy should promote secure health information that protects patient privacy by continuing to implement things like multi-factor authentication and encryption and other types of protections. As you can tell, the draft does not go into too many specifics on programs and policies that particular federal agencies are going to implement. And Congress may pass legislation that alters the ability of the agencies to commit resources to these specific objectives. However, it's an important marker for where the federal government is going to be focused and allows the private sector to look ahead as well. As I mentioned, public comments on the draft are due by March 18, 2020. And stakeholders should consider submitting comments to help guide these efforts moving forward, particularly if your organization or technology presents a novel issue that may not fit squarely within the parameters of the framework. K&L Gates is uniquely positioned to advise clients on a broad spectrum of healthcare, life sciences, and technology matters, and to facilitate stakeholder engagement through public comments and other means. Thanks for listening to this episode of Triage, and have a great day.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.